All right, today we are diving deep inside the human body to watch one of medicine's most incredible fights, the war on cancer. We're going to break down the powerful and honestly pretty strategic world of chemotherapy, looking at how these drugs fight a really complex battle at the cellular level.
Really think about that for a second. The enemy isn't some germ from the outside. It's your own cells that have gone rogue. And that question? It's everything when it comes to understanding chemo. Because it's not just one pill, it's a whole arsenal of sophisticated battle plans designed to outsmart an enemy that grew up in the neighborhood, an enemy that knows all your body's secrets.
But here's the thing, every enemy, even one from the inside, has a core weakness. For cancer, it's all about bad information. The DNA, the cell's instruction manual, has this critical glitch, a typo that basically just screams copy, copy, copy forever. So every single strategy we're about to look at is designed to do one thing: shut down that disastrous command. Okay, so let's talk strategy number one. This is the most direct, kind of brute force approach. If the DNA blueprint is the problem, well, the goal is to corrupt it, damage it, or just completely destroy it so it can't be read anymore. This is a full frontal assault on the cancer cell's command center.
A class of drugs called Anthracyclines really shows this brute force method in action. They attack on multiple fronts at once. First, they jam up this crucial enzyme. Think of it as the cell's photocopier, so the DNA can't be uncoiled to get copied. Then, they literally wedge themselves right into the DNA, just garbling the instructions. And if that wasn't enough, they create these destructive little molecules called free radicals, which act like tiny grenades, just shredding the blueprint from the inside out. It's a total blitz.
Let's zoom in on that one tactic for a second, intercalation. It's just a brilliant illustration of how physical this battle is. The drug molecule literally forces its way between the rungs of the DNA ladder. Imagine trying to read a book, but someone stuck a big fat wedge in between every single sentence. The information becomes completely useless to the cell.
And hey, anthracyclines aren't the only ones doing this kind of damage. Mitomycin, it acts like a staple, cross-linking the DNA strands so they just can't be pulled apart to be copied. Bleomycin is even more direct. It makes those free radicals that act like molecular scissors, literally snipping the DNA. But, and this is a big but, all this brute force comes with a price. Each of these drugs carries a serious risk of specific side effects, damage to the heart, shutting down the bone marrow, or serious toxicity in the lungs.
And managing that risk is absolutely critical. For a drug like bleomycin, the potential for severe lung damage is so real that there's a lifetime cumulative dose limit, 400 units. That's it, for your whole life. It's an incredibly powerful weapon, but one that doctors have to use with extreme care.
Okay, so that's the frontal assault. But what if, instead of just overwhelming force, you could find a unique vulnerability, a secret weakness that only the cancer cells have? Well, that leads us right into our second strategy. This one is way less about brute force and much more about clever, tactical moves. A perfect example of this is the drug asparaginase. It's so elegant. See, certain leukemia cells have this fatal flaw. They can't make their own asparagine, which is a vital nutrient. They have to grab it from the bloodstream. So the drug asparaginase just goes in and eats up all the asparagine in the blood. Healthy cells, they don't even care. They just make their own. But the leukemia cells, they're cut off from their only food supply, and they starve. It's a beautiful and incredibly targeted strategy. Here's another way to cripple the enemy. Just cut off its supply chain. Instead of starving the cell of food, you starve it of raw materials. To build new DNA, you need these little building blocks. A drug called hydroxyurea just blocks the enzyme that makes those blocks. So it doesn't destroy the blueprint, it just stops the factory from getting the ink and paper it needs to make any new copies. And this contrast really gets to the heart of how chemotherapy has evolved. On one side, you've got the broad attacks, the carpet bombing of the older drugs. They work, but they cause a lot of collateral damage to any healthy cell that divides quickly, like your hair follicles or your gut. On the other side, you have these targeted strikes that go after one specific flaw. And that second philosophy, that takes us right into the modern era of cancer treatment. This is the guided missile approach. Instead of carpet bombing the whole area, these drugs are designed to find and lock on to a very specific molecular target that is unique to the cancer cell, leaving most of your healthy cells alone. The absolute poster child for this strategy is a drug called imatinib. In some leukemias, there's this one faulty protein that acts like a stuck gas pedal for cell growth. It's just floored all the time. Imatinib is a molecule that was custom designed to fit perfectly into that one faulty protein, like a specific key for a specific lock, and turn it off. The gas pedal is released, and the out-of-control division just stops.
And the results are just stunning. This drug is so specific that it's mainly used for just a few cancers that are driven by that one particular faulty protein. It completely revolutionized the treatment for chronic myeloid leukemia. I mean, it turned what was once basically a death sentence into a manageable, chronic condition for so many people. That is the incredible power of a targeted strike.
But here's the thing. No matter how smart the drug, no matter how targeted the missile, these are still incredibly powerful chemicals acting inside a person. The final, and you could argue the most crucial element in this whole battle, isn't a drug at all. It's the expert human team that manages the entire battlefield, making sure these treatments are safe and effective.
And at the absolute forefront of that team are oncology nurses. They are the field commanders. They're doing the pre-battle checkups, they're handling these hazardous drugs, they're monitoring the infusions minute by minute, and, so importantly, they're educating and supporting the patient, the person at the very center of it all. They manage the battlefield so the drugs can do their job.
Why is that constant monitoring so vital? Well, some of these drugs are so potent that if they leak from the vein, there's a fancy word for it, extravasation, they can cause devastating damage, necrosis, to the tissue around it. A nurse's watchful eye is literally the #1 defense against that kind of catastrophic event.
And beyond just giving the drug, nurses are masters of managing all the side effects that come along for the ride. From the bone marrow suppression that can make you tired and open to infection, to the nausea, the painful mouth sores, all of it. They provide the care, the medicine, and the advice that makes it possible for patients to get through it and finish their treatment.
So what a journey, right? We've gone from brute force attacks on DNA to these elegant strategies that starve cancer cells, and finally to these precision-guided molecular missiles. The story of chemotherapy is really a story of becoming more and more sophisticated, which of course begs the question, what's next? As we get even better at mapping the unique flaws of each person's cancer, are we heading for a future where chemo means a treatment designed just for you? That's the question that drives cancer research forward every single day.